Hi, my name is Beth Breitmeyer, and I am doing the macro planning level presentation. My focus is the social problem that I'm focusing on is mental health of the LGBTQIA youth and the lack of an affirming community in school. The target population is Lafayette High School in Lexington, Kentucky. So the population in need, Lafayette High School has about 2,500 students. It's estimated that 9.5% of that youth is identify as LGBTQIA+. Within that community, 49% of that youth seriously considered suicide in the past year, and 17% attempted suicide. 78 experienced symptoms of anxiety, 62% experienced depression. Access to mental health care is lacking. 58% said they wanted to receive care but did not. And the primary reason is they were afraid to talk to mental health professionals about their concerns and who they were related to LGBTQIA circumstances. This population has felt physical threat and harm. 44% said that they had experienced that, while 77% said they experienced discrimination in their experiences as youth. The rationale for this is that these students are having mental health issues. They aren't able to go, they don't feel safe to go to a mental health professional, but also that there are not affirming spaces for them. Only 38% said that home was an affirming space. In addition, what I found very interesting is that they also said that 73% felt that their friends were provided high support for them. Now, what's interesting is that friends are in school, so there's affirmation there, but they only feel 32% feel that the school is an affirming space. So the rationale here is I want to explore and try to bring together those two areas, friends and school. Some more rationale is that I have two students at Lafayette High School, one identifying as trans. Also, Fayette County Public Schools and the Kentucky Department of Education is opening up a lot of doors to pursue areas and ways to make more affirming places for this population. The evidence-based practices that I found in my literature review really focused on ways to create a more safe environment for these youth, all providing a variety of support at several different angles. But what I found most interesting was the bystander intervention, as it is the most in-depth and most empowering for all of the community. My summary really came up with three main things. One, creating a safe place must be intentional and action-oriented. It can't just be a policy that is written. Two, that the LGBTQIA community really has subgroups, one that focuses on sexual identity and one that focuses on gender identity. And finally, these microaggressions and name-calling, bullying can be very damaging, in fact, more so than the overt discrimination that might be experienced at one particular time. So the bystander intervention was what I felt was really empowering. This intervention trains teachers, staff, and students to intervene when name-calling bullying occurs, and also focuses on modeling and role-playing as to how to react to those situations. Within the training, it gives real language and tools to intervene through modeling practice and role-playing. It acknowledges that the name-calling, bullying, and microaggression are linked to serious mental health. It also acknowledges that 87% of youth say they've seen aggression but have not intervened. So what this intervention does is it builds sort of a culture of advocacy where if we see the behavior, we act and we model appropriate interpersonal skills. It's intentional, it's systematic, and it's a supportive intervention. Engagement is also key. Engagement would include how do we get them involved? So educating what this at-risk youth population is going through, addressing bullying of all kind, building safe communities for all. So that engagement needs to include parents and administrators, staff, teachers, and students to see that this act of aggression needs to be addressed and addressed by all people. The assessment and the target for change is to see faculty and staff intervene when they see this name-calling, bullying, or discrimination, and creating a culture of advocacy and supportive community for our LGBTQIA youth at Lafayette High School. Finally, the strengths that I see in this proposal is that Fayette County Public Schools, where Lafayette is located, and also the Kentucky Department of Education, are primed to work on this issue and to help find supportive ways to help these students with those mental health issues. There are GSAs in all the high schools. There are representatives and advisors for that LGBTQIA population specifically, and the Kentucky Department of Ed has offered guidance on pronouns, chosen names, and disclosure. So the strength really here is that it's open, the community is open to these changes. The timeline, of course, would be within a year's time of engagement, education, implementation, and evaluation. The focus on LGBTQIA youth is controversial, and that is a potential challenge. Not all stakeholders believe this is important or should be supported, so there is a political backlash. In addition to a challenge is that we need to maintain consistency throughout the year and maintain that focus. Finally, mental health. This is a mental health crisis of LGBTQIA youth. Within a year, almost 50% of the students consider suicide. Also, finding identity is what adolescents do. It's a stage of development, and youth need to feel safe to explore themselves to create that foundation who they are going to be as adults. Creating a safe setting for this stage is crucial to adolescent development and ultimately happy and mentally healthy young adults. In addition, giving the tools to youth and teachers to intervene when they see abuse is empowering and community building. Lafayette High School is primed for progressive change and support for this population. The district and Kentucky Education Department has opened the doors to improvement. This initiative can create a culture of advocacy and safe spaces. Thank you.